freshman orientation, Wharton's Vice Dean addressed us. Statistics professor and Vice Dean Richard McClellan said sonorously, "When you graduate 4 years hence, about 1/3 of you will go to law school. 1/3 of you will directly pursue graduate studies in business, and the remaining 1/3 will enter the business world. Our advising services are at your disposal to guide you." The Vice Dean paused. There seemed to be a stray thought he was seeking. "Every couple of years, one of you wants to go to medical school. I do not know why anyone would want to do that. If you want to do that, go see the pre-medical advisor, not us." With such a warm welcome to Wharton, I wish to assert this evening that there is no one in this room more surprised to see me standing at the podium now. I was the beneficiary, while at Wharton, of the love and support of my parents and my 2 sisters. As a Yale medical student, I fell hopelessly in love with Sharon Rosenblatt and had never stopped. To her and our daughters, sons-in-laws, and grandchildren, all credit is due for anything I've done in my adult life. I was the beneficiary for almost 25 years of the support of my assistant at work, Ruth Altman, passed away in 2012. May her memory be for a blessing. I am grateful for the last 7 years of support at work from Vilma Bordinaro. I had many fine professors at Wharton. Aron Kostanyan had freshly emigrated from the Soviet Union and taught us Soviet economics. In the Soviet Union, there are 2 sorts of people when you discuss economics. He's optimist and he's pessimist. What in Soviet Union when discussing economics is pessimist? In Soviet Union when discussing economics, pessimist is fully informed optimist. And what in Soviet Union when discussing economics is optimist? In Soviet Union when discussing economics, optimist is properly instructed pessimist. I have devoted my career to the causes, prevention, and treatment of childhood cancer and academic administration. They are linked. Universities form humankind's efforts to prevent death and disability. Childhood cancer reminds us of what Hubert Humphrey said. The moral test of government is how it treats children, the elderly, the sick, the needy, and the handicapped. We face multiple moral tests nowadays. When I matriculated at Wharton, they told us we were attending the West Point of American capitalism. What I thought then, and I'm sure of now, is that the belief that the invisible hand of the free market will lead to ultimate well-being is a snare and a delusion. Any physician can cite a long list of failures of the free market. I'll offer you 3. The first failure is poverty. Poverty is a carcinogen. Poverty causes diabetes and cardiovascular disease. The second failure is the promotion of products resulting in preventable disease. Government policy has abetted business avarice to create food deserts and market tobacco, alcohol, sugar drinks, fat, salt, and firearms. The third failure concerns chemotherapy. We cannot give patients some of the well-established cancer drugs because the American free market won't produce them anymore. The market inhibits adequate drug development in childhood cancer because it considers it unprofitable. We know that when large pharmaceutical companies acquire smaller firms, about 6% are killer acquisitions. An acquisition of a small innovative firm for the sole purpose of terminating its research in order to preempt future competition. The effect, of course, is to stifle the production of new drugs. Maimonides taught that one should see the world and see yourself positioned in the world upon a scale of an equal balance of good and evil. When you do one good deed, the scale is tipped to the good, and the world is saved. When you do one evil deed, the scale is tipped to the bad, and the world is tipped towards destruction. As it is written in the book of Proverbs, Tzadikim Yosei Olam, the righteous person is the foundation of the world. Wise public deeds lead to improved outcomes. Bad public deeds lead to bad outcomes. The wise policy of the expansion of Medicaid under the Affordable Care Act has virtually eliminated racial disparities in access to treatment for advanced forms of adult cancer. Unfortunately, there are plenty of examples of bad public deeds. I wish to believe that decent Americans, if they watched me help clinically manage an immigrant 20-month-old with metastatic cancer, would not say that the most important thing to do is to build a wall to block access of that baby to treatment. I was recently asked to see a teenager with leukemia needing total body irradiation. ICE wants to deport the child directly out of his Westchester Medical Center hospital bed. Get a move on, doctor, and see if you can beat them up to the hospital room. These stories are the moral tests on the scales of our time. Like we say back home in North Carolina, you all better decide like the song from Kentucky goes. They say in Harlan County, there are no neutrals there. Which side are you on? Which side are you on? Neutrality helps the oppressor, never the victim. In times of moral crises, the greatest crime is silence. You were very kind to present me with this award. There's much more to do, and so I hope someday to show that I might have deserved it. Thank you.